Welcome to this week's episode of the Caring Generation podcast, number 248, Aging Parents Support Through Surgery, Caregiver Advice, and Elder Care Support. Today we'll talk about how to deal with planned and unplanned surgery, using a hip surgery as an aging or aging parent health issue. There are over 400,000 hip replacements annually in the United States, with about 70 to 75% of these, 280 to 300,000, occurring in persons over age 65, which these days is considered elderly. I would disagree. Specifically, I'll share aging parent care tips before and after surgery. I'll talk about defrailing, which you may have never heard of. It's basically improving your all-around health before surgery. I'll share experiences of my clients related to pre-surgery risks and their after-surgery experiences of working to get back to normal. And then I'll share things that you can do to make a return home from the hospital or a rehab facility easier. This caregiving advice, it applies to any surgery for older adults, with the recommendation that you discuss it with your physician and ask questions. Because if patients don't ask questions, physicians can't read your mind. And a lot of times, unexpected things then happen. Because doctors assume that if you're not asking, you already know this information, or in some cases, patients just don't want to know. Many people that I talk with in my virtual consultations tell me that they don't know what to ask. So if that's the case, get out your pens, pencils, computer, laptop, take notes. Consider this podcast as caregiving education to give you thoughts about questions to ask for any surgery type situations. If this is your first time listening, welcome to the Caring Generation podcast, filled with advice and tips about aging, elder care, and caregiving. I'm Pamela D. Wilson, a professional caregiving expert with 25 years of experience and your host. If you are a return listener, thank you for adding the show to your playlist. Please do me a favor, post a positive comment on your podcast app. This will help the show reach more listeners around the world, and I would really appreciate it. So let's start with important but rarely discussed information around surgery for older adults. As I mentioned, surgery can be planned or unplanned. You may know that you need a hip replacement because of pain, or you unexpectedly fell and broke a hip. That would be unplanned. Either way, health conditions and physical activity levels before surgery have a major impact on the body and the mind after surgery. Doctors really don't have time to go into this in depth unless you specifically ask questions before surgery. The time that anybody does go through this is when they're discussing the complications of surgery with you when you're already in the hospital, and they're asking you to sign that release form that you probably didn't read, acknowledging that anything and everything can go wrong during surgery, and that there are no guarantees that you'll come out better than before you went in. So let's take a step back, though, and figure out how on earth this happened. Let's say that you or an elderly parent fell and broke a hip. What was the reason for the fall? How did it happen? Most people will say, well, I tripped or I turned and I ended up on the floor. Well, that's the result, but what's the not so obvious reason? This one might take a little bit of thought. Factors that can be responsible for falling can be physical frailty or weakness, poor balance, hearing or eyesight deficits, You didn't see the curb. You didn't see that rock on the sidewalk. Maybe you have some type of inner ear balance issue that makes you dizzy. Some medications can make people more prone to falling. Do you know what these are? Are you taking any of these? I'll mention a couple later in the show. Other things that can cause falls: a sudden infection, like a urinary tract infection, which is very common in older adults. Also, pneumonia, dehydration, or sepsis, which is a very serious infection, can cause a fall. Then there are other health conditions: diabetes, heart disease, orthostatic hypotension. This means that when you stand up, you become dizzy. Actually, you do become busy, but you become dizzy with a D because of a change in blood pressure. Then there's peripheral artery disease and a lot of other conditions that can cause falls. A complication, having osteoporosis, which means weak bones, can result in a higher likelihood of a fracture for the person who falls. So if you're listening and you haven't yet fallen or broken anything, thank God. But talk to your doctor about whether you or your parent has any health conditions that make you more prone to falls. Also ask if any of the medications you take increase the risk of falling. You might not know this, but some medications for incontinence and pain increase fall risk. I know this from my experiences managing care for older adults. And in case you're wondering about that, I'm Pamela D. Wilson, a caregiver expert, educator, speaker, and expert witness, 25 years of professional experience helping aging and older adults and their caregivers discuss, plan for, work through complicated family relationships, develop elder care strategies, and manage healthcare, financial costs of care, and the responsibilities for family members who are acting as legally responsible parties. You can learn more about me by going to my website, PamelaDWilson.com. If you or an elderly parent have multiple health conditions, these can present to be a surgery risk and also a list of caregiving challenges to manage. Here are some of the risks caused by surgery that person asking you to sign that release form may have explained to you. For example, blood clots in your legs, which is why they put those inflatable balloon type things on your calves before surgery and why they leave those on while you're in the hospital. There's delirium, which is mental confusion that I'll talk more about. Urinary tract infections, loss of muscle mass from laying in a hospital bed, bed sores, lung conditions, pneumonia, and so on are all surgery risks. Research and practical experience confirm that surgery for a person with multiple health problems is riskier than surgery for a person without multiple health problems. That's probably logical. The recovery process and time is also different for people who were physically independent and active before surgery versus those who use a walker or a cane or are in a wheelchair who are less physically active. Falls in general are a risk, but falls are also an opportunity if you're planning to have any type of surgery. Lower muscle mass, bone mass, or strength that can be identified as osteoporosis, and a lack of physical activity are all aspects of frailty that can be identified. There are physical tests that you can do, like sit to stand up from a chair. You can be assessed for hand grip strength, and you can also get a DEXA, D-E-X-A scan that can tell you more about your bone mass, your muscle strength, and other factors. I did this a few months ago for myself because I wanted to learn more about my physical condition because I work at it. I go to the gym. And I also wanted to know if I was a risk for breaking a bone. I do a good bit of hiking during the summer months. And because of where I hike, falling is always a possibility because there's a lot of climbing over rocks and going up and down steep hills. Many DEXA companies don't take health insurance, nor do you need a physician's referral, although there are DEXA scans you can get with a physician's referral paid for by insurance. Now, the DEXA scan that I got was private paid, but it gave some pretty amazing information that I never got from the DEXA scans that were previously ordered by my physicians. It gave me my body fat content, my bone mass, my muscle strength, and it actually gave me my biological age, which is 15 years younger than my actual age. So I was pretty happy about that. If you're wondering what the cost is, it's somewhere between $99 and $200. But I can tell you a lot of the DEXA scan places have promotions where it's 50% off. So it may only be $99. I will say that it is well worth it if you're interested in health prevention, if you want to prevent frailty and falls, and if you want to work on what I call defrailing, that I'll talk about in a minute. It's also worth it if you're active and you're willing to do the work to address any issues that come out of the scan. So let's say that you or your parents are frail. You go get a DEXA scan, whether you pay for it privately or the doctor orders it and your insurance company pays for it. Then what you find out from that can determine whether or not you start to work on defrailing. Your doctor is probably not going to even know about this term. It's a term that those of us who work on our health know about. But basically, it means taking action to address physical weakness, any type of early cognitive impairment, malnutrition or nutrition, and any other conditions that negatively impact your daily functioning. If you got a private DEXA scan, you can show it to your primary care physician to get their recommendations. And if you know that you're having any type of surgery and you work on defrailing, you might recover more quickly than you would have previously. So there's benefits. Now I want to talk about delirium. There is a video about delirium on my YouTube channel with a lot more information. To find it, go to Pamela D. Wilson or search for Pamela D. Wilson, caregiving expert on YouTube. And then there's a little window there and you can type in delirium and it will come up. But here's the thing related to delirium and surgery. It happens in 28 to 50% of elderly persons undergoing general surgery or hip fracture surgery. Now you might wonder, well, why does it happen? It happens because of chronic health conditions and a previous diagnosis of dementia. This delirium, it can take days or weeks. I've also known it to take months for an older person to recover from delirium. The anesthesia partly impacts delirium. So we've kind of talked about some pre and post surgery concerns for you to be more aware of. It's important equally to ask your doctor and your surgeon questions about what you might expect if you do have multiple health problems. Ask the doctor whether you face more risks and what those are. Ask the doctor if it will take you more time to recover. And especially ask about activities that you can do and others that you should not do. Sometimes after surgery, you can't lift anything more than 3 to 5 pounds. You shouldn't be bending over and doing certain activities. You may have to wait a few days before you start showering by yourself or walking a block. Because there's what's called this getting back to normal after surgery, which anybody who has surgery would want to do as soon as possible. But doctors and surgeons don't usually offer a lot of information about getting back to normal, except what they tell you is average recovery times of 3 months, 6 months, 9 months, 12 months. Now, this depends on your health condition before surgery and how active you are, your cognitive status, and really how hard you're willing to work at physically recovering, because the recovery part, the doctor writing a physical, occupational, nursing order, that is really up to the person to pursue that and to do those activities. Let me just share some challenges that my clients experienced after general surgery or hip surgery. So, the obvious one is pain. If you're having any type of surgery and they are cutting into your body, there's going to be pain. Now, relative to hip surgery, in a perfect world, right after the hip surgery, the person is up and walking the next day. I know you're thinking that sounds crazy, but it's true. The longer a person lies in that hospital bed, the longer the recovery will be, and the greater the risks of things like bed sores, issues with incontinence, potential blood clots, like I mentioned before. Then my clients were tired or they were exhausted after surgery because it's a major event on the body. As I mentioned, there can be issues with urinating. You might be nauseated from the pain medications. Maybe you're not hungry, but you know you need to eat. You want to sleep all day. Then there are kind of more unexpected issues like cognitive issues. Maybe you are in that percentage of people who have delirium, or maybe you're just a little more mentally confused because of the anesthesia. Now, if you have a parent with dementia or if you have memory loss, there's probably a higher likelihood of being negatively impacted by the anesthesia. Ask the anesthesiologist about that before your surgery. So, what happened to my clients was many of them struggled a little bit with organizing their thoughts, or they were a little cloudy, or they had difficulty initiating activities after surgery. Some of them were a little more stressed out, impatient than they normally would be for just a short period of time. Then add to that, there's what I call the regaining independence part. I want to get back to normal as soon as possible. The hard part to accept is that after surgery, you may not feel like yourself for a little bit of time. It's hard to know how long that time is. Everybody's different. But you may not be able to immediately get in the car and drive somewhere. You may not be able to lift heavy items like a bag of groceries or even your laundry basket to carry it to the wash machine. You may not feel safe showering or taking a bath without having somebody around the house just in case you need a little bit of help. Cooking a meal, that may take all your energy, and then you kind of go back to bed. There are so many things that are not considered or discussed in detail about before and after surgery because most people that I know, and even my clients, they were worried about just making it through the day of surgery and doing any type of pre-op work like blood work and tests that they had to do to be able to have the surgery done. So if you're having surgery, or a parent is having surgery, planned or unplanned, here are some other tasks to consider to complete before surgery. Interview and hire a non-medical in-home care agency to help with all of those tasks I mentioned, like laundry, grocery shopping, picking up prescriptions, cooking meals, being around just in case help is needed for bathing, dressing, bending over to put on your socks and shoes. Yeah, that one's amazing. It can be a bit of an ego hit when you can't bend over and do that for yourself. Then, what about rolling trash cans to the curb, picking up the mail? There's a very long list of daily activities that can be difficult for a few weeks, if not longer, after surgery. Hire lawn or snow care if you don't have that in place. Maybe consider a housekeeper to get the house clean from top to bottom before you return from the hospital. And then think about having it done another time before you're fully recovered. You may need a dog walker or a pet sitter. Think through everything that you do every day and take for granted that might be more difficult to do during your recovery period from hip surgery or general surgery or a knee surgery or any type of surgery. Well, and then let's talk about the discharge. Doctors don't talk to you about discharge planning either. You don't really hear about this until you're in the hospital. And so then you can't plan for it, right? So, previously healthy and active people usually return directly home after hip surgery. Adults who have multiple health conditions, those who were not physically active, usually don't go right home. They usually spend about 20 days in a nursing home for physical rehabilitation, which I do recommend if you are not super strong and active or self-motivated or even know what exercises to do. What I can tell you is when I managed care for my older clients, skilled nursing rehab, always necessary because most of them were frail. They were not physically active or strong. They had a lot of health conditions, heart disease, diabetes, asthma, COPD, arthritis, dementia. Some of them previously had cancer and a lot of other conditions. So for these clients, going to a nursing home and having a daily schedule that included rehab exercises and meals and socialization, it was extremely important for my clients to get into a new routine so that they had the opportunity to return to their prior level of daily activity or even the possibility of a higher level of daily activity if that hip surgery was planned and it was causing them issues. Many of my clients also needed to have their nutrition assessed because good nutrition, having enough protein in the diet, is a huge component of healing. Now, I know I'm hearing it from y'all. Nobody wants to go to a nursing home. They're bad places. Well, not all of them. But in this case, if you don't have good motivation and a physical routine, and if you don't know that your nutrition is good, it can honestly be the best thing. It can be a learning opportunity for you and your parents if the person who had the surgery wants to get back to normal or better as soon as possible. Now, I will say when you go to a rehab, you also will be prescribed physical and occupational therapy when you go home to be able to continue to do that in your home, just like the people who went from hospital directly to home. They have the opportunity for physical, occupational therapy and nursing. Now, let's talk about dementia. Dementia and rehab for hip or other surgery. Nobody talks about this. By the way, there is an entire program about caring for aging parents on my website, PamelaDWilson.com. There's a separate, extremely detailed module there, all free, about dementia care planning. It's packed full of dementia advice and support from my 25 years of experience when I was managing care for older people. To find it, go to PamelaDWilson.com, click on the Support tab, and then Caring for Elderly Parents program. The program is also good if you are an aging adult caring for yourself. I can tell you, you will learn a lot. So, if your parent breaks a hip or has to have surgery and they have dementia and they go to rehab, you will want to put in the extra effort to be at those rehab meetings at the nursing home, or find another family member to be there, a friend, or hire a non-medical in-home caregiver to be there. Because of the dementia and potential delirium and the effect of the anesthesia, your loved one may refuse when they're asked to go to physical therapy. The physical therapist may come up and say, "Oh, Mrs. Smith, it's time for PT. Do you want to go?" Their answer is going to be no. Or They may go, but they may not want to do the exercises or even remember how to do them. So if that physical therapist gets a no, they're going to put in the notes, patient refused physical therapy. And then they're going to go to the next patient and they are never going to come back to your loved one. So what do you think is going to happen? A, your parent won't get the rehab they need to get better. B, the nursing home is going to be calling you to tell you to take your parent home because they're not participating. This is typical. Be forewarned. Do not be naive. 20 days of rehab paid for by Medicare or Medicare Advantage, it is not guaranteed. I know there's a lot of things to talk about here regarding pre and post surgery and discharge planning, but I can't mention all of them in a single podcast. So, where do you find this? There are over 1,000 videos on my YouTube channel. Search for Pamela D. Wilson, Caregiving Expert on YouTube. There are articles and blogs on my website, PamelaDWilson.com. Almost another 250 episodes of this podcast, The Caring Generation, plus 3 online courses on my website. And if you still have questions, you can schedule a one-on-one or family virtual consultation with me. Go to PamelaDWilson.com, click on the Services tab, and then Elder Care Consultation, where you will find a form to fill out on that page to contact me, and I will respond about scheduling. So now let's talk about sleep, which is a big one in addition to post-surgery pain. Sleep is healing. It is replenishing. It is good. But if you have hip surgery and you're used to sleeping on the side where your hip surgery was done, you're not going to be able to do that. Or let's say you used to sleep on your stomach. That's going to be uncomfortable. You might struggle to sleep on your back. And then, nobody thinks of this one. You get into bed, right? How easy is it going to be to get out of bed? It might not be easy. It might be really hard to turn over and sit up and push yourself up to get out of bed. I know that sounds really silly, but wait until you experience it. It's real. That's the time when one of those floor-to-ceiling poles can come in really handy. Then let's talk about pain pills. Well, they can make you feel like you're hungover and you didn't even have a drink. By the way, no mixing pain pills, alcohol, or any type of substances. That is a potential way to ensure that you fall again and break something else. Pain pills, though, they can also make older adults more likely to fall again. They can make you nauseated, and so you don't want to eat. So there's this fine line between managing pain and feeling well enough to do physical and mental exercises. I will say in my experience, the time that you can commit to physical therapy and daily exercise, and I seriously do mean daily scheduled exercise, that is going to have a direct impact on the speed of recovery. Now, initially, as I mentioned, there can be challenges between getting a good night's sleep, managing pain, having the energy to do physical exercises and mental activity. If you're a caregiver, you may have to work really hard to motivate your spouse or your parent or grandparent or another family member to do this. I encourage you to do so. Most of my clients who recovered quickly made a concerted effort. They got their heads wrapped around, I have to be physically active. I need to be mentally engaged. And it didn't matter whether that was doing their exercises, talking with friends, going out of the house, walking around the house, going to the grocery store, doing crossword puzzles. I will tell you, sometimes just getting out of bed, getting dressed, and getting out of the house, that's a big accomplishment after surgery. Now, the other thing that nobody talks about is that mental challenge of thinking, I can do this and I can do it safely, which is why it's important to have somebody around at first, just to make sure that you can. And then when you advance to not having anybody around, it's getting over the insecurity of going out again by yourself, maybe getting over the idea of the fear of having another fall if that's how you fractured your hip, because fear of falling can be a big deterrent to getting back to normal. Now, if you're not aware, there are GPS devices that you can wear, a pendant, a watch, so that your family members can know where you are if you do go out for a drive or for a walk. So that if you don't call them, they can figure out where you are. Or you can use one of these devices to issue a SOS call for help if you don't feel well or you experience another fall. So it's kind of like this little safety protection device that you can get. Because sometimes, honestly, just knowing that you can call somebody for help adds a little bit of confidence and security to going out. You can also, though, call a friend before going out and say, look, I'm going to the grocery store. If I don't call you in an hour, please call and check on me. And don't think that these devices are silly, right? I have one of these devices when I go out and hike in the middle of nowhere. I have a Garmin, and that Garmin tracks exactly where I am and if I would fall off the side of a cliff or injure myself. It has an SOS button that I can push. That makes me feel a little bit more comfortable that, if I'm out in the middle of nowhere and something happens, I can get some help. So don't think it's silly. Defrailing and regaining function after any type of surgery can take effort. Defrailing takes effort before surgery. Regaining function takes effort after surgery. And these are good aging strategies. They're good elder care strategies to make sure that you're living your best life and you're being as active as you want to be. Sometimes recovering from surgery, it's way easier than you think. Other times, it's more difficult. And then other times you're on a timeline where the doctor's like, well, you have to wait 4 weeks to do this, and you have to wait 6 weeks to do that, and 8 weeks to do that. And while it seems like it's forever, follow the doctor's orders because heaven forbid you injure yourself after surgery and you have to go back and have it done again. Not to mention the fact that you have surgery and there's no way of preventing or predicting, I should say, the outcome. We don't know what's going to happen. So the more that you and your parents and your family members seek education before surgery, the better. The more questions you ask, the better. Do this regardless of whether you're in good physical condition or if you have health issues, because you want to put yourself in a better position to recover and to be better. Talk to your doctors, talk to your surgeon, be as informed and educated as possible. Education is power. And one more thing that nobody else tells you about either, there's a long list, but make sure that your health insurance company pre-approves your surgery if that's required. The last thing you want is a big bill and a surprise that your doctor's office didn't send the required pre-authorization to your health insurance company. I have seen this happen more than once. So if you need further help on preparing, planning for surgery, education, or support on this topic, you can schedule a one-on-one consultation with me. I'll share my 25 years of experience with my clients who have had a variety of surgeries and just all of my experiences. I'm Pamela D. Wilson, a caregiving expert, educator, and expert witness, 25 years of professional elder care and caregiving experience in the areas of health, healthcare, managing family relationships, financial and legal matters related to health and caregiving, and everything in between. You can schedule a one-on-one consultation with me. I also do private family elder care mediation. My website's PamelaDWilson.com. I thank you for joining me for episode 248 of the Caring Generation podcast. More information on this topic, links to articles, and research are on the website page for this podcast. To find it, go to PamelaDWilson.com, click on the media tab, and then the Caring Generation. You can scroll down to episode 248. And while you're there, check out the other 247 episodes. There is also a contact button on my website to contact me, to schedule a consultation, to sign up for my newsletter, and other things. I thank you all so much for being here. I look forward to being with you again soon. God bless you all. Sleep well tonight. Have a fabulous day tomorrow and enjoy every single day until we are here together again. And thank you in advance to those of you who will take a minute right now to go on your podcast app, enter a positive comment about the show. It helps other people find their way here. Until we're together again soon, have a good day.